Welcome, everyone in the United States, Canada, and around the world to another episode of It's a Wrap with Rap, the podcast of overcomers and useful information to better our daily life and well being. I am your host, Ron Rapaport. I would like to thank all of our great listeners, viewers on our YouTube channel. It's a Wrap with Rap, the podcast uncut, and our sponsors and supporters for making the podcast such a success. Besides being heard on all major platforms throughout the world, the podcast may also be accessed from the website itsawrapwithrap.com, where you can find all the episodes, previews of future episodes, the podcast Book Nook, showcasing many of the books our guests have authored, and a link to subscribe to the podcast mailing list, as well as products and services offered from our sponsors. A wedding gone wrong. The beer barrel polka landed our guest, Stacey Roberts, a seasoned registered nurse, holder of a Master of Science in Nursing, a physical therapist, pelvic and sexual health physiotherapist, functional medicine therapist, and author of her new book, The Pain-Free Formula: Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections, and also the owner of the New You Health and Wellness Practice in Wauwatosa, Wisconsin, is with us today as our guest. The moment of that dance gone wrong sparked her mission to transform pain care. The result, the pain-free formula, a breakthrough approach that targets the root causes of chronic pain instead of just masking the symptoms. Although pain management became a medical subspecialty in 1995, millions still suffer from unresolved pain tied to hormonal imbalances, food sensitivities, and old injuries. With over 30 years of experience, Stacey blends soft wave therapy with cutting-edge, non-invasive treatments to help patients find real, lasting relief. Her expertise has not only guided everyday patients to freedom from pain, she has also worked with over 10 national professional athletic teams, helping elite athletes recover faster and perform at their best. Stacey blends a rich tapestry of expertise in functional medicine, physical therapy, nursing, and complementary medicine. She utilizes high-tech treatments, evidence-based testing, and treatment programs, combining the most up-to-date strategies with timeless holistic practices. Since 1990, she has been the compass guiding patients through the landscape of pain reduction, improved vitality, weight loss, hormone optimization, and addressing gut health issues. Stacey has created sanctuaries of healing from the United States to the sunny shores of Australia. She has been featured on World News Now's Oprah and numerous Australian media, and hosts her own podcast, The Pain-Free Formula. Welcome, Stacey, to the podcast.
Ron, holy mackerel. That was an amazing introduction. Thank you so much.
Well, you deserve it after I've read all about what you've accomplished.
I
Now,
appreciate it.
can we please start out with telling us how the beer barrel polka dance set you off on a path to become involved in a mission to transform pain?
Absolutely. Yeah, the beer barrel polka took me out, Ron. It was a sight for
That's
sore
what I
eyes.
read. That's what I read.
So I was at a wedding with my son, who is at that time in his early 20s, and was watching him have a blast. And he was having fun on the dance floor, and a polka came on, and was attempting to do the polka, and I was a little bit embarrassed for him. So I got up there to try to teach him how to do it properly. And you, having lived in Wisconsin, you know that that's a foundation, right? We need to know how to do the polka. So during the polka, all of a sudden we're doing the 1 2 2 1 2 2, and then pop, my knee goes. Massive searing pain in my knee. I didn't know what the heck happened. I stopped right there, and in mid step, and my son's like, "Come on, what's going on?" And he saw a little tear kind of come down my cheek, and he hasn't seen me cry, I don't know in how many, probably decades. And he's like, "Oh gosh, something's wrong." So I had to hobble off the dance floor. My knee blew up to like 3 times its size. Being a physical therapist, I knew what to do. I knew how to treat it, but I was really curious about what that particular pop was, like what structure, what was going on there. So I had all the
Right.
testing done. Got better with soft wave therapy, and 3 treatments, was off my crutches by then. And I found out that my meniscus were all crazy torn, but that was clearly not due to that Polka accident that had happened over time. I had massive amounts of arthritis in my knee, also not because of the Polka accident, but one of the things that brought to the forefront that you can have significant arthritis and not have pain, because I didn't have any pain up to that point. And then I messed up some ligament doing the Polka, kind of the stuff related to hormonal imbalances and the changes that happen with ligaments and other structures in the body as we get into menopause. But what prompted me to write the book, Ron, was I went to the doctor to have a, professional kind of conversation about what that structure was that popped. I was curious. I wanted to see if there's any surgery needed, anything like that. And she looked at my x-rays and said, basically, it doesn't really matter what that pop was. You need a knee replacement. Your knee's full of arthritis. We can either give you a shot of cortisone or do this knee replacement. And I'm like, whoa, wait a minute. We haven't even gotten to talk about like what we could do from a rehab point of view, like what the structure was. And she said, again, it doesn't matter. We can't do a clean out. There's too much damage already, and you just need these done. And I was appalled that that was the first option instead of the last one. And it just made me think, how many hundreds, if not thousands, of people are getting that same bit of advice every single day when they could do something that's non-invasive, something that can really improve their situation without doing such drastic measures, or without doing cortisone injections, which we know now, it's proven, will deteriorate the joint over time instead of help it heal. So that's what prompted me, my frustration and anger, and really thinking, wow, people are being led down a certain path when they really need to be opened up to what the possibilities are that they could do. Now, I'm not saying I'm against surgery, Ron, because if that's what needed to be done, that's what I would have done. But when it's such a big surgery like a joint replacement, again, in my opinion, that should be the last thing that we look at, not the first.
Yeah, absolutely. Now, for our audience, you practice functional medicine and holistic treatments to get results.
Mhm.
Tell our audience what functional medicine is and the things that make your approach to pain-free living different from other professionals practicing traditional approaches to pain management.
Sure. So functional medicine as a whole is looking at the person in my view, in a more holistic way, right? Not just looking at us as a part, like just my knee, but really looking at the whole body. So for many people who go through conventional medicine treatment from, your regular physicians out there, they are usually prescribed a medication and then maybe physical therapy, maybe. I think only about 10 or 15% of the people that could benefit from physical therapy are actually prescribed physical therapy. And then, if the pain doesn't go away, then like what happened to me, they're given, shot, or offered a shot. I refused the cortisone myself, but other people will have it, and then surgery, right? So that's kind of the conventional approach. Well, the medications that are given at that initial treatment, what I found in my research with the book is that they actually slow down the process of healing and can accelerate your body's pain sensitivity, meaning by taking those for long term, for whatever reason, the pain actually hurts more, especially when they wear off. And then we need more and for longer periods of time. So our approach is, okay, let's try to minimize those medications or potentially get off them, because we also know that long-term use can cause liver issues or kidney issues, depending on which ones they're taking, or addiction issues if you're talking about opioids, right? So our goal is to get people at least minimizing them or off of them, because the pain that the person's experiencing is a message from the body. And we want to listen to that message to point to go, okay, what is the problem? What's the underlying cause of the problem? And then we treat that underlying cause. And that's really the goal of functional medicine, is to get to the underlying cause and treat that so that you can have long-term relief and not setting yourself up for other problems down the road.
Right, and people don't understand pain. The pain you're experiencing, your body is really protecting you. It,
Hmm.
it's you hurt your finger. Well, you're not gonna hit your finger if you don't have to. So
Right.
yeah,
My friend Jack Canfield, the author of the Chicken Soup for the Soul series, he described it as, it's like taking your batteries out of your smoke detector in your house, right?
yeah,
So, the fire is still there. and it's going to get you at some point, but you don't hear the alarm because it's being covered up instead of being addressed.
Right. Now, has the conventional medicine practicing community, have they turned the corner on accepting and using these techniques?
To an extent from soft wave therapy. So soft wave therapy is a type of modality that's utilized. I was just at the Naval Academy this weekend training their athletic trainers on how to utilize it. I've trained the Yankees and the Red Sox and other professional teams on how to utilize this modality because it accelerates healing.
Yeah.
And more medical practitioners are starting to utilize shockwave therapy in order to help with inflammation. So in that way, yes, but from a holistic and functional medicine point of view, like bringing in optimizing gut health, looking at hormones, no, I would say the vast majority, even the vast majority of physical therapists, don't have the background in order to help their patients with with those types of things as
Yeah, and
well.
we're gonna get into soft wave therapy,
Mhm.
and just for my information and the
Mhm.
audience, is that synonymous with shockwave therapy?
Yeah, it's a type of shockwave therapy. There's
Okay.
several different types, and
Okay.
softwave is an electrohydraulic, what we call broad focused shockwave
Okay.
device. So it's a little bit unique in the shockwave of the shockwaves that are out there.
Okay. Now, what are some of the common misconceptions about pain management?
Well, I think common misconceptions is we're going to take a pill and it's going to go away, right?
Yeah.
So that's not allowing the body to heal. Now, sometimes it works if we have an acute, injury, we take that, and then, 2 weeks later, whatever, it's gone. But that if we didn't address the underlying issue, we're still setting ourselves up for that to come back or to create another issue because we haven't addressed the underlying cause of that one. So I think that's the biggest misconception, is that a pill is going to resolve the issue. And we've all been conditioned to take a pill instead of really thinking about what else we can do. Like back in the day when I had pain, my parents, if I had a headache, my parents would say, go have some water or go out and play, do something, not taking a pill. But one time I was on a flight back from Australia and I was sitting across from this mother and son. And I remember noticing them because or we were on a bus from one terminal to another after a long 14-hour plane ride into LA. And I remember noticing them because he was about the age of my son at the time. And I remember he had his head in his hands and he was like, Mom, I have a headache. I have a headache. And she shuffled into her purse, got out a pill of some sort and kind of yanked him and said, Here, take this. And he's like, No, I don't want to. And she's like, Take this. And he's like, No. And then she grabbed him and he looked at her in the face. And if you've ever gotten that look from your mom, you know what that feels like. And
Yeah.
she's like, take it. So he took it, took the water, and then, not complaining later, but that water alone would probably have helped him. He was probably low blood sugar, dehydrated, all that
Yeah.
type of stuff. But even from a young age, Ron, we're now being conditioned to be like, okay, this one pill is the quick answer to your pain, to get rid of it quickly, instead of thinking, okay, you're dehydrated, you need something to eat, maybe, that type of thing. So I think that's important to realize.
Uh, is one of the misconceptions inflammation, the term inflammation? Because everybody hears that term and they go, oh, got inflammation, I guess I better pop a pill.
Right. Well, inflammation is not all bad. It gets a bad rap. So we always want to say we got to eliminate inflammation, take this anti-inflammatory medication, da 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 da. Well, that's not necessarily true. We need inflammation to start the healing process. If we don't have inflammation, then we don't start the healing process and then we don't heal. So if I scratch my hand and it was red and puffy, that's the pro-inflammatory aspect of inflammation. That's like if there's an accident on the highway, those are the first responders going to the area to start to heal or clean up the mess, right? So that's our pro-inflammatory. Then if once that, let's say on the highway, we take care of everything, then the police and then the road workers to get the traffic going, in a normal pace. Those are our anti-inflammatory molecules. So if I talk about that scratch again, it's no longer red and puffy, but it's a little sore and I can still see the scratch, but I can see that it's healing. And then the next phase is just the body healing it. So we don't even see that scratch anymore and traffic, with that analogy, going back to normal. That's the body's natural healing process. So we need some of that inflammation for healing. We don't want to get rid of it completely like cortisone does. That cortisone shuts down the inflammatory, both pro and anti-inflammatory. And then that's been shown now to degrade the joints more faster and more so in the future. So what we want to do is nudge the body into doing what it's supposed to do in that pro-inflammatory, anti-inflammatory natural healing. So the anti-inflammatory medication is kind of a little bit of a misnomer in that it's decreasing the pro-inflammatory response so it doesn't hurt as much.
Hmm.
That slows the healing, right? So we want to move you into an anti-inflammatory process.
The It's a Wrap with Rap podcast, distinguished guest and author John Jay has written his just released book, Nanette's War. The book is a true story of a young Jewish girl coming of age in France during World War II as the Holocaust approaches. The girl, Nanette Dreyfus, belonged to one of the most influential Jewish families in Paris, second only to the Rothschilds. Her family's social circle ranged from Albert Einstein to Colette. All that privilege counted for nothing when the Nazis arrived, as the family was high up on their list of targets. Inspired by diary entries, family papers, photo albums, newspaper clippings, notices, testimony from relatives, and correspondence from friends, and most importantly, conversations the author had with Nanette before she passed, the book narrates the family's fall from grace alongside the creeping understanding of the German friendly Vichy government's collaboration with the Nazis. Through Nanette's eyes, we witness how it all unfolded, from the anti Semitism on the school playground, sometimes even from her own teachers, to Nanette's first crush under a false identity. Woven into the political backdrop of a nation turning inward on itself, this is the story of a life once filled with riches becoming rootless, where friends were left behind and politicians legislated their own people out of existence and to their deaths, culminating in what we now know as the Holocaust. The author John Jay himself, a child of Jewish survivors, is a master storyteller, presenting us with a psychological narrative of getting by, getting along, and not getting caught. The book is a story of grit and girlhood set against a dark time of deportation. Nanette's War is available from Amazon, Barnes& and Noble, or wherever books are sold.
So a little bit faster with something like shockwave or other modalities, and then allow the natural healing process to occur.
You know, it's kind of interesting because I had an X-ray of my knee the other day, and I looked at it, and not being aware of how to interpret X-rays,
Mm-hmm.
I was looking at a lot of inflammation, and apparently, and I thought that was the issue, and they said, "Oh no, don't worry about that.
Mm.
That's just inflammation." And I do remember many years ago, as a runner, I went to a foot doctor, and he looked at my X-ray, and he said, "Oh, you got all this inflammation. You're like, your foot's the age of a 90-year-old. Never will run or speed walk again on that." And I
Wow.
just went, forget it. And
Yeah.
I did it like 20 years after that, and I
Yeah.
had no problem. So,
Right.
I just, yeah. Uh, what role does stress play in chronic pain?
So there's two types of stress, the physical stress, right? So, the physical stress of continuing to irritate that area. If you're walking, like if your biomechanics are off and you're
Yeah.
walking a certain way, that continues to trigger that stress. So that's physical stress that creates that inflammation. But then there's also the emotional and physiological stress, right? So if we're under a significant amount of stress and we have, some niggling injuries, or if you're female or male and you're going through some hormonal transition, right? And our hormones are kind of anti-inflammatory molecules, so that if they're decreasing over time, then we've got additional physiological stress from those being kind of out of whack. That leaves us into a point, or cortisol, if cortisol's high, that's the stress hormone, that leads us into a point where there's more inflammation and our body is less equipped to address that inflammation in a way to move us to that healing process. So stress overall long term can exacerbate issues and pain that we're already dealing with. And it also puts the body, Ron, it puts the brain on high alert. So that stress is on high alert, or that brain is on high alert due to that excessive stress, which puts us into that vicious cycle of feeling pain more and the body overprotecting us, almost doing its job too well, so that we don't want to move, we don't want to do this, or where we feel pain that's much higher than what it would normally be otherwise. So it kind of accentuates and exaggerates that inflammation and the brain activity that's trying to protect us from getting hurt again.
Okay. I also wanted to know, could you comment two other things? Uh, what role does hormones play in joint and muscle pain?
Yep. So we've alluded to that a little bit already in that when our hormone levels go down in men, testosterone, and
Yeah.
in women, estrogen, progesterone, those were actually acting as really nice anti-inflammatory mechanisms for our body. So as those hormone levels go down, and men, they should go down a lot later, although I'm seeing a lot of men who are in their 30s, 40s, and 50s that have lower testosterone levels. And women, as you know, like in the 40s and 50s, going through perimenopause and their estrogen progesterone levels decreasing. So that decreases our protection against stress. So let's say we're stressed at work and we may not have the best eating plan. Although we try, we're still eating more of an inflammatory eating plan. Our hormones have given us some protection against that. Well, now we don't change our habits, but the stress plus the stage of life that we're in starts to decrease the amount of hormones that we have that are protecting us. That inflammation bubbles up to the surface, and then we start having joint issues. Women start having hot flashes. Men can get really fatigued, and both men and women can get fatigued and have brain fog. Digestive issues start to bubble up to the surface as well too. So hormones have a direct impact, but even the thyroid hormones can have a direct impact on muscle pain. So what we need to do is go, okay, what's the cause of that underlying issue, which is the hormones decreasing? Women aren't going to reverse menopause, but we can manage those hormone levels so that we do still have a protective effect. Same with men. We can manage testosterone so it still has a protective effect. And then we change the other things like our eating plan. We adjust those things and look at what we can do to optimize gut health. And all that together helps to minimize the effects of our lower level of hormones.
Okay. And can you just briefly tell us about the gut joint and gut brain connection and how it affects our health?
Yep. So for almost a decade now, slightly more, we know about the gut-brain axis. So the gut has a direct connection to the brain in many ways, from a standpoint of the microbiome, also to the vagus nerve as well, which both of those help to regulate pain, inflammation, and metabolize different hormones. But what's really interesting is when I was listening to a talk about the gut-brain axis, and if we have certain diets that make our gut more permeable, or some people call it leaky gut, a substance called lipopolysaccharides can leach into the body, create inflammation. And in this particular person, Ron Rapaport, who's excellent, she has great information on her podcast. She talked about that relationship between anxiety and depression when those lipopolysaccharides get cross that blood-brain barrier and cause that. And I said to myself, I wonder if that's the case for joints. Like, could that be happening with joints and deterioration of joints? And sure enough, there's the gut joint axis. So the same thing can happen if the gut is too permeable to substances that should be removed from the body but are instead getting into the body. They can settle in our joints. So we can have elevated levels of this inflammatory molecule called lipopolysaccharides in our joints, which then also deteriorate our joints as well too, and cause that inflammation and pain. So by us correcting what's going on in the gut, even if you don't have gut symptoms, that can go a long way to impacting what's happening in our joints and muscles as well too.
And I want to tell our audience, I read Stacey's book, and we'll comment on the book later. It's a great book. It's full of just chock full of information that I think everybody probably will be interested in. So
Thank
if
you.
you can grab a copy of it, that would be great. Now, I want to move on to soft wave therapy. You utilize soft wave therapy for many pain issues. Tell our audience, what is it and why does it work so well? And how the heck did you discover it?
So soft wave therapy is a type of shockwave therapy. There's several different types of shockwave out there. There's even something called shockwave that doesn't produce a shockwave. So buyer beware. You want to do a little research and ask lots of questions of the person who's presenting it. Shockwave therapy was developed back in the day after the bomb was dropped on Hiroshima and Nagasaki, and the shockwaves from that explosion significantly impacted the human body. So what some
If you are enjoying viewing the podcast, we would appreciate you spreading the word by sharing the podcast to your family and friends. Please visit the podcast website, itsawrapwithrap.com, where you can find all the episodes, previews of future episodes, the podcast book nook, showcasing many of the books our guests have authored, and a link to subscribe to the podcast email list, as well as products and services offered by our sponsors.
Smart person said, well, I wonder what we could do with this that could actually help the human body, not hurt it. So what they did is took it from this explosive type shockwave into more of a laser-like shockwave, and they aimed it at kidney stones and broke up those kidney stones so it became a non-surgical approach to getting rid of kidney stones. They had to be under anesthetic. It's a very high amount of energy. It would have hurt just way too much for the person to be awake. When they started doing that, they noticed that the vertebrae, the vertebrae in the spine, started to become more dense, and they thought that's interesting. So they tried it on fractures, broken bones that weren't healing, and sure enough, all of a sudden those fractures started to heal after not healing for months and months. So that was, again, really interesting. They thought, okay, how could we do this on tendons and ligaments and things of a less dense structure without damaging them? So they brought it down to low intensity, and low intensity shockwave is what's going to be in most of the practitioners' offices that have it from an outpatient basis. And most of the shockwave devices come out like a laser beam, like that lithotripsy, but soft wave comes out more like a flashlight, like the original type of shockwave, and it still has its focal effect right in the middle. So we don't know exactly why it works so well, except for the standpoint that it moves the person from when it's done correctly, it can move the person from a pro-inflammatory phase into an anti-inflammatory phase, and then allowed the body to heal faster than it would otherwise. So I came across it because a friend of mine who I was treating her shoulder for many years. She and I have been friends for 40 years, so I've literally probably treated every part of her body by this time. But she had this shoulder issue where at the end of the range, she'd sleep on it wrong or go for a pickleball, like something overhead, and it would hurt. Other than that, it was fine. But she wanted to get rid of that one symptom. So she found this soft wave device about an hour and a half from where we live. And she's like, would you go with me to the appointment? He's going to bring it down here. I'm like, well, it's not going to work. It just looks, it
Yeah.
can't do what it says it's going to do. There's no way. I've never seen anything like that in decades. So there's no way that something's out there that I didn't know about. So I was a little cocky, I'll have to admit, but very skeptical.
Yeah.
So she said, look, I'll take you to lunch. So I said, okay, I'll go. So I went to the appointment, and I probably was just, I know I was annoyed being there and not really into it, thinking this is just going to be another rep meeting that I've sat through, hundreds of them in my career. And all of a sudden she's sitting there. Remember, I told you that she only had pain when she'd raise her arm up over her head, right?
Yeah.
Well, as the device was going over her shoulder, the device was able to elicit that same pain that she had in that movement pattern, even though her arms were at her side. Now, if you're a physical therapist, you understand that that's pretty relevant, because we try to create the specific pain so we know what structures are involved. And we usually have to take the person into the movement, not just have them sitting at rest. So that made me lean in and think, what's going on with this? Well, after the treatment, she raised her arm up, Ron, and she goes, I don't have any pain. And I was like, okay, whatever. It'll be back in a couple days. Well, a couple days passed, a couple weeks passed, and literally a couple years passed before I saw her again for her shoulder issue, again with a good old pickleball issue. But what that taught me is I needed to look more into it. I was still skeptical. I wasn't all in by any means, but it was around COVID, so I dug into the research. I had time to do that, and it took me about, I would say, 8 to 10 months or so of really trying to figure it all out. And then I tried all the different devices, and Softwave was the one that my patients really loved and thought it was less painful than the other devices, and they got better faster than the other devices we tried. So I'm learning more and more about it. I teach a bunch of courses on it as well. And as we've talked about, I go across the country, train therapists as well as train therapists, chiropractors, as well as professional sports teams and even professional athletes and their staff on how to utilize Softwave because it's so effective.
Is this something that can be bought by anybody?
If you want to buy it for your own personal use,
Yeah.
it's, anywhere between 50 and 80 grand. So some
Oh,
people will buy it for their own personal use and have their own private PT or whoever administer it.
yeah.
But it's a prescriptive device. So you have to be a practitioner that can use
Yeah.
electrical modalities
Okay.
in order to purchase it. There are some devices on the market called shockwave, and even some from very well-known people that I won't name here they're not actually shockwave. They're those radial wave devices that they're trying to sell at a lower cost point,
Oh,
and they don't produce a shockwave. They may work for a few things, but they don't work as extensively as true shockwave does.
okay. Stacey, what body parts can be treated with soft wave therapy? And could you name some of the top conditions it treats?
Sure. Traditionally, any kind of tendonitis, plantar fasciitis is a big one. I do see a lot of adhesive capsulitis or frozen shoulder, knee issues, arthritis, really from top to bottom. If there's inflammation and it's related to muscle and joint, there's a very good chance, and even nerve issues, inflammation of the nerve, there's a very good chance that SoftWave can help with that. And the practitioner understands the mechanism of action of the device, so they should be able to tell you, oh yeah, if you have this issue, it should most likely help if it's localized. And I talk a lot about that in my book. There's some patients who I've taken through SoftWave, and they should be 50 to 100% better after the first treatment. That should last a couple days. The next treatment should last longer. The next treatment should last even longer. So about 3 to 6 treatments is all you should need if it's only localized. If by that third treatment round they're not where they should be, they keep going back to kind of baseline. That's where we talk about the functional medicine and say there's something else going on. We're taking care of the localized inflammation. If you picture a pitcher just dumping out the localized inflammation and the body's filling it back up. So we've got to figure out what the body's doing from a systemic point of view to fill that inflammation back up again.
So I would anticipate there's certain parts of the body you can't use it on. Is that like maybe where the organs are or near the heart or something?
No, for SoftWave specifically, you mentioned the heart is really amazing. Over in Europe, they've used SoftWave on the heart after open heart surgery,
Yeah,
and the patients have increased their what's called ejection fraction of the heart, which is kind of a reflection of the strength of the heart, of
sure.
how it can beat by 40%. Decrease opioid use by a significant amount as well too, because they're getting to that inflammation early. They're moving them into that anti-inflammatory, allowing the body to do the pro-inflammatory phase, and then getting them into that anti-inflammatory phase much quicker.
So
So
you don't have to worry about organs.
no, not with SoftWave. Some of the other devices that are focused only,
Yeah.
they tend to say not over these types of organs, and certainly the high energy ones as well too. But with SoftWave, but because of the way that it's utilized, I've used it over the abdominal for women with endometriosis, scar tissue, postpartum, all that type of stuff. I've not used it over the heart, and I won't. But as I stick with what my scope of practice is,
Right.
and but really, head to toe, any of those issues that involve muscle and joint, you should be able to utilize it.
What about neuropathy?
Neuropathy it can help with, but the thing about neuropathy is you have to find the cause. So you could have neuropathy that's because you're low in B vitamins. You could have neuropathy because of a medication-induced neuropathy. You could have neuropathy because of you have food sensitivities that are creating this systemic inflammation. So if you can find the underlying cause of neuropathy, and please, anybody who's listening and is considering spending like $6,000 or $10,000 on a neuropathy program, you've got to work with somebody instead that's trying to find the root cause why you have the neuropathy first, like diabetic neuropathy. I could treat neuropathy and get rid of the symptoms with SoftWave, but if they have their blood sugar levels that aren't being regulated, it's just going to come back.
Yeah.
So we work together with them, SoftWave, to help with decreasing the inflammation around the nerves, bringing more nourishment to those nerves, and then addressing the root cause of why the neuropathy was there in the first place, whether it be diet or looking at their medications or finding out what micronutrients they may be deficient in. And those things are really important in addressing that neuropathy as a whole.
Now, you said you work with professional athletic teams. Can you tell us how some of these pro athletes avoid surgery and pain meds and what teams you have worked with?
Yep. So what we utilize SoftWave for is obviously treatment of injuries, but what is really nice for the athletic population is prevention of injuries. So if you've got, let's say, a pitcher or you've got a volleyball player, or you've got, a quarterback, and they're using their arm a lot. And a lot of their injuries could be due to overuse. If you do soft wave once a week or once every couple days, just around the area, it helps us see if there's any inflammation that needs to be addressed sooner rather than later. And also the athlete feels great after it because it improves the mobility, it builds their confidence in that area. So we use it for injury treatment, but also injury prevention as well too. And I've worked with the Red Sox, the Yankees, the Dodgers, trying to get into the Packers. If you know anybody, Ron, let me know. Packers and Brewers, I need to get in there.
Yeah.
Um, the Naval
They're
Academy,
having a great year, the
they
Brewers.
are, exactly.
I know.
The Naval Academy, I'm trying to think who else. I've worked with the
Dr. Scott Geis, a podcast guest, has written a must-read story about a small-town dentist and his battle against an unjust legal system. In the blink of an eye, Dr. Geis went from a respected small-town dentist to a convicted felon. His crime? Trying to provide the best care for his patients. In this It Could Happen to You story is a chilling account of how an all-American success story became a nightmare of false accusations, legal manipulation, and ultimate betrayal. With raw honesty and dark humor, the author recounts his journey from the heights of professional success to the depths of a federal prison cell. This gripping memoir exposes the shocking flaws in our justice system where innocence is no defense against the crushing machinery of a federal prosecution. This story of Dr. Geis is a stark warning in a world where plea bargains have replaced trials that anyone can become a criminal overnight. The book exposes how easily innocence can be buried under the weight of incompetence and the system's thirst for conviction. Every business owner and medical professional should read this book. This It Could Happen to You is more than just a cautionary tale. It is a testament to resilience, a father's love for his children, and one man's unwavering determination to reclaim his life and reputation. After learning the difficulties of restoring one's stature in the community after an injustice due to the flawed legal system, readers will be inspired to question the system and stand up for justice. Dr. Geis's insider perspective on both the medical and legal professions offers a unique glimpse into two worlds most of us only see from the outside. This It Could Happen to You story is a must read for anyone who believes in the American dream and anyone who fears it might become a nightmare. Because, as this story proves, it really could happen to you. The book is available from Amazon.
Bruins. I've worked with the New York Nets. There's a bunch of different professional teams, and there's a couple. There's a celebrity that I worked with. I had to sign an NDA she's a performer on stage a lot, tours the world, the world, and she uses it for her backup dancers and things like that. Trying to think who else. A couple professional sports players again sign an NDA, so I can't say
Yeah,
who
no,
specifically
no,
they are, but
obviously,
yeah.
yeah.
Hmm.
That's very interesting.
Yeah,
Now,
it's a lot of fun.
yeah, would you please tell us about any new breakthroughs coming in the pain management arena? Because I know when I was trained, I've got a pharmacy background, and
Hmm.
when I was trained, there just wasn't a whole lot of things coming out about pain management. It was, it's kind
Yeah,
of nothing new. Is
right.
What about now? A lot of
I
things.
think I think now the biggest thing, I can't speak much for the conventional side of things and medications and drugs that are coming out, but I do think us understanding from a research point of view how the heck the gut impacts it. Like, are there specific probiotics that we could take that can help us with weight loss or joint pain or improving overall brain health, right? So I think that area is blowing up as far as figuring out how the gut is impacting the rest of our body. So I think that's really important. We're seeing more information on hormones as well too. That hormones can obviously impact not only hot flashes in women, but joint pain with women as well too. So I think more and more people are open to hormone replacement therapy. I again think that oftentimes is used too soon. We need to look at the gut. We need to look at food sensitivities. We need to look at general lifestyle changes that we can make during those transition times, and then look at some hormone support if needed. But not everybody needs that. So I think we're seeing a lot more information about hormones as well too.
Okay. Uh, what are the steps people can take listening out there to avoid unnecessary surgeries
Mhm.
for pain relief? And what are the statistics citing unnecessary surgeries being performed for pain, such as joint replacements? Do you have any figures for us?
Yep. So the Journal of American Medical Association says that over 100,000. I can't remember if it's 2/3 or 1/3 specifically. Joint replacements are considered unnecessary, right?
Wow.
That these people are getting joint replacements when other things could have helped them instead. So in many things, and another thing that's kind of on the horizon too, related to your earlier question, are stem cells and PRP injections.
Right.
Those things are coming along for pain relief as well too. But there's a lot out there about unnecessary surgeries and infections as a result of surgeries, which are on the rise much more than they've been previously. People reacting to the different types of joint replacements that they are having as well too. So I think that's important to again look at those as the last resort instead of the first step, because there's so many things that can be done. And what was the other part of that question, Ron? Sorry.
Uh, what can people do to avoid unnecessary surgeries? What steps
That's
can
probably the most important part of the question.
they? Yeah.
So, so the first thing is you want to get with somebody, whether it's a physical therapist, a chiropractor, or somebody who understands biomechanics, how our bodies should move, and they can look at you, see how you walk, see how you lift something, see how you raise your arm overhead, and go, okay, this is what your body is not doing, or this is what your body is doing that's creating more inflammation. So correcting those biomechanical issues through appropriate stretching, strengthening, just analysis of movement. That's number one. Number two is getting to somebody who has something like soft wave therapy or soft wave therapy to see if this is a localized pain issue. So really correcting the biomechanics, addressing the localized inflammation with something like soft wave. And then if that's not knocking it out, that's when you look at and you could do this all at the same time, obviously, but that's when you look at more of an anti-inflammatory eating plan. Are there food sensitivities, things that I'm eating that are good foods, but maybe not just good for me, and that's causing inflammation in my system, like we talked about related to gut health?
Yeah.
Having your hormones assessed, see where your hormones are at, and what can we do to help to balance those, both naturally or with medications, and then addressing stress. So those are really the 5 steps that we utilize to help patients with a holistic program, so that we don't want them to just feel good in their knee. We want them to feel good in their whole body, right? So you can be
Right.
as active for as long as
Right.
possible.
I mean, it's just amazing how you can go out now in the general population and you talk to people, uh, generally, people over 50 or whatever, but not
Yeah.
necessarily. There's a lot of young
No.
ones. And
Yep.
everybody's had knee replacements
Yeah.
and shoulder replacements. I mean, this is like what? Uh, the biomechanical men and women out there.
Yeah.
It's just so
And those
much,
are
and you wonder, wait a minute, is this really necessary?
exactly. And when I first started off in the 90s, I graduated in 1990, the age for joint replacement was usually 65 and up.
Yeah,
Now it's, 50 and up. And
yeah,
I think, your listeners can come to their own conclusion, but when they figured out that, when they looked at sham surgeries, when they looked at surgeries meaning that they pretended like they did the surgery, like they may
right,
have, cut some, made some incisions in your knee, versus actually having the surgery, like for a meniscus repair, that the sham surgeries, the one where people only thought they got the benefit from the surgery, actually they did better than the ones who actually had the surgery. That decreased the amount of insurance reimbursement for those types of surgeries. So that they lost a lot of money from not having those millions and millions of procedures done. And then all of a sudden, and again, I'll let your listeners make up their own conclusion, all of a sudden then they're doing earlier knee replacement surgeries, earlier shoulder replacement surgeries, earlier hip replacement surgeries. So I don't know, that seems like a coincidence that happened around the same time to me. but it is. And, it's something where we see younger and younger people having the issue and also them having more problems than I've ever seen
Right.
as a result. Some people do great, which is fantastic, but I see the people who are having issues.
And when you say sham surgery, you're talking about a placebo effect.
Exactly.
Yeah.
Yep.
Like giving somebody a sugar pill and saying,
Yeah.
you should feel better now, and they do.
Yeah. And maybe it's the 6 weeks that they took off because the other people had to take 6 weeks off of work too. Maybe it's the less stress because you have less pain, right?
Right.
Because you're not moving as much. Who knows what it was, but huge placebo effect, and there's nothing wrong with that. I mean, we should be studying the placebo effect, see
Yeah.
why it helps so many people.
Now, what prompted you to write the book, The Pain-Free Formula, and what do you hope people get out of reading the book, which is an awesome book, by the way.
Thank you so much, Ron. I really appreciate that. Well, it prompted me the frustration of what I realized was more of a if not local, but a global epidemic of surgeries too soon, medications too long, and people not being educated. Like, I think a lot of people, if they knew they were doing to their body by continuing to take these things, I think they would give it a second thought, right? Some might
Yeah.
continue, but others would at least be able to make that choice. So I wanted to help people get the right information so they could make the best choice for how they manage pain or how they get rid of it. And my message to people is pain does not have to be a life sentence, right? If we find the root cause, we listen to our body and address those underlying issues, we can have a pain-free life. And that doesn't mean you don't ever have pain, because I want you to have pain because that protects you, right?
Right,
But I
right,
don't want you to have pain that takes control of your life and keeps you from doing what you love to do.
right. You also have a podcast. Can you just briefly, we're running out of time here.
Sure.
I could keep
Yeah.
you here all day and
Thank you.
uh,
Yep.
tell us about
Yeah, I
your
could talk about
podcast, The
this.
Pain-Free Formula.
Yep. The Pain-Free Formula podcast, we go over, quick 15 to 20-minute episodes, up to an hour worth of episodes on specific diagnoses, or like just dropping a couple episodes about new research in regards to certain medications that are out there, and helping people, again, give them more information, expanding on the information in the book, and helping them, again, take control over their life to get themselves as active as possible for as long as possible. And we're also not just deal with physical pain, but emotional pain. We had an episode on grief and how people can address grief, because there's all sorts of different types of pain that we deal with in our life. And I want to give people an opportunity to find some tidbit that might help them, either by taking it to their practitioner or something they can do themselves to really help them manage their situation in their life.
You know, Stacey, on this topic of your podcast with pain, you're never going to run out of episodes.
Right?
Yeah,
Exactly.
yeah.
I'd love to interview you as well and see how your journey has really
I'll talk
impacted
to
your
you. I'll
life and
talk
life.
to you offline about that.
Yeah, for
Uh,
sure.
how can people contact you?
So they can reach out to me at newyouhealthandwellness.com. That's in Wauwatosa, Wisconsin. They can email us from there, join our newsletter. They can find me on any of the podcast outlets for the Pain Free Formula podcast. And they can, if they purchase the book on Amazon, there's also some free ebooks that they can get as a result, focusing on biomechanics, hormones, and gut health as well too. That'll give them more information.
Okay, so I'm going to repeat. I'm going to put that in the podcast notes for the audience. It's you want to contact Stacy. It's new you health and wellness.com. Now, as someone with 30 plus years of experience, what advice do you wish everyone knew about living pain free?
Is that it's possible, right? We oftentimes feel like this is our lot in life, that, we're never going to get over the pain, we're never going to get better, but
Yeah.
it's possible to get rid of it and, live that life where you're as active as possible for as long as possible.
Okay, great advice. I want to thank you, Stacy, for being on the podcast, shining a spotlight on the subject. And for those out there needing more information, I hope you contact Stacy and read her book. I want to wish you good fortune going forward with all the work that you're doing, and you're doing great work. Thank you so
Thank
much.
you. Thank you so much for the opportunity. I really appreciate it.
My pleasure. Comments and suggestions for the podcast, you can email me at it's a wrap with rap at gmail.com. We're on Facebook. We have a Facebook group, a couple thousand people in there. It's a private group. So if you want to join, just contact us. It's a wrap with rap is the name of it. We're on Instagram. It's a wrap with rap podcast. We're on X at Rapper, WRAPPER130. We're on YouTube. All the episodes are on YouTube. Go to It's a Rap with Rap, the podcast, uncut, and our website is itsarapwithrap.com. I want to thank everyone for listening. I want everyone to please stay safe. And for now, it's a wrap.